To introduce the student in our story, Alice is off to college and happy to have some freedom. After complaining about some bad test scores and feeling tired, a friend suggests taking Adderall to stay awake and be more productive with schoolwork and studying. One night, she decides to combine Adderall and alcohol at a party for some more excitement. She takes a few Adderall to increase her energy and focus. She is constantly losing track of her consumption of alcohol, leading her to drink more than she normally would. Alice begins to have chest pain and feels ill, even to the point where she's vomiting. Her friends are very concerned and take her to the hospital. There, it is revealed that she has alcohol poisoning and changes in her EKG, showing a possible myocardial infarction.
So what happened to Alice and why?
Adderall is a stimulant and alcohol is a depressant. Adderall is approved for 3 conditions: narcolepsy, ADHD, and weight reduction. It has a high risk for abuse and addiction, as well as cardiovascular effects, including increased heart rate, elevated blood pressure, and damage to blood vessels. The liver is involved in the metabolism of both alcohol and amphetamines, creating a competition between the 2 drugs. Taking too much of a stimulant causes many extreme heart problems, especially with larger doses. One such example is an irregular heart rhythm. Combining Adderall with alcohol will lessen the effects of alcohol and cause the person drinking to consume more than they usually would. As stated before, the competition of each drug during metabolism is the cause. The body processes the drugs more slowly due to them using the same enzyme during metabolism. Using Adderall after periods of hiatus use can increase the user's risk of cardiovascular effects.
With the Adderall dulling effects of the alcohol, this can lead to excessive drinking in order to feel the buzz of alcohol. The most life-threatening consequences of mixing these 2 substances are heart dysrhythmias and alcohol poisoning. Our case study shows an example of a student that experienced an amphetamine-induced coronary spasm and myocardial toxicity as a result of combining Adderall and alcohol.
Adderall is a danger to college students and possibly even high school-aged children. Some students use Adderall without a prescription to keep themselves focused and concentrated while studying or completing assignments. The doses taken without a prescription are often much higher than a prescribed dose would be. Many college students are drinking alcohol at some point during the year, sometimes in large amounts. It's very dangerous not to recognize the consequences of alcohol and Adderall that they carry by themselves, let alone the effects when the drugs are combined. Since Adderall can mask the effects of alcohol, the individual may be consuming more alcohol while taking the drug. This can lead to a dangerous amount ingested quickly without the effects and feeling of being drunk. This topic was chosen because it's important to inform college students and high school students of the potential hazards of both drugs individually as well as combined. Even students that have a prescription for Adderall may not realize the dangers of using both drugs at the same time. Alice is an example of a student who was not informed and suffered the consequences. An interprofessional and a large community effort are needed to promote better community and patient education on the dangers of combining these 2 drugs. The student population seems to be educated on the benefits of Adderall, but often do not know the dangerous side effects, especially when combined with other drugs. For more information on the dangers of Adderall and alcohol, please contact the National Drug Abuse Hotline at 888-633-3239.